Hey guys, Dr. Anderson here, and I'm here to talk to you about what I call Restless Legs Compression Syndrome, because I really do believe that for many of you, your restless legs is caused by compression of nerve tunnels in the lower extremity that become too tight. And we've been doing procedures in the operating room here for well over 10 years now, and able to help most people with the restless legs by opening up these nerve tunnels that have become tight. Years ago, several years ago, we used to do intraoperative nerve monitoring, and this is the monitor right here. And I wanted to share with you that we have a second paper. We've already published one paper, but hopefully a second paper soon to be published that's going to share some data showing intraoperative nerve change in the operating room. So that's more rigorous information to share with the public out there in the medical community, to show that indeed we are making your nerves work better after the tunnels have been opened compared to before. This is much like doing carpal tunnel surgery. So what we did with this machine, we had electrodes in the muscles of the legs, and we would stimulate the nerve before the tunnel was opened to see what kind of a reading we'd get, and then we would repeat that process after the nerve tunnel had been opened, where the pressure had been released, and we'd see huge amplitude changes. It's called an action potential. Maybe you took biology, that might be a familiar term, an action potential. So we actually measure those. So this is a machine, guys. It's not me or the patient thinking that they did better. It's a machine saying that there is objectively showing evidence that there is an improvement of nerve function. So that's something I wanted to share with you. And something else I wanted to mention is my book. It's called A Perfect Night's Sleep. And you can actually go through here. There's parts of this that are going to explain how I became aware of this situation and kind of my pathway in life that led me to this. I feel really fortunate that I've had the opportunity to help so many people. And then we have different testimonials here. This is Bonnie, for instance, and it's showing her and her results, and how much what kind of a reading she got before and after decompression. This is like at 3,400, and it went all the way up to around 8,600 millivolts. So getting kind of technical there, but I just wanted to let you know, consider reading this book. Some of you that come in from out of state or other countries, you've read the book. It really gives you a lot of good content, a little bit understanding of how we do this. It's a bit of a mind shift, a bit of a paradigm shift, because so many of you are looking at it metabolically. You're looking at dopamine, you're looking at iron, all these other things you're hearing out there. And a lot of it, to me, is really motivation to sell you drugs. And Big Pharma is really pushing these things. And you know, it does help you. For many of you, it may be useful. But I'm just saying, if you really want to consider reversal of this, and it's a serious issue for you, this is an option that maybe you ought to consider. And know that we love this machine because this is what's helped us do some research in the past. Unfortunately, the cost of doing this is not affordable for us now. We quit doing it a few years ago just because we just can't crunch the numbers to make it work in our surgical center, unfortunately. But the good thing is we have the data from previous patients, and this is like a coach, if you will, for me in the operating room. It helped me do my procedures better. I was always trying to get a better reading, and it helped me, gave me feedback when I was opening up these nerve tunnels as to how much would be appropriate to open up and such. So it's a good feedback mechanism for me as a surgeon back in those days. So something I want to share with you. Please consider my book called A Perfect Night's Sleep. You can get on Amazon, and remember, we're on Facebook. You can find us there too. So any questions you have or comments, we appreciate, and please consider subscribing to our YouTube channel. Thank you for watching.